This is WSAC First Look at 4. The team that's always making a difference.
Valley Health celebrating 50 years of service to our community. Joining us to tell us all about this big anniversary is President and CEO Dr. Mathew Weimer. Great to see you.
Thank you for having me.
Yes, and congratulations, 50 years.
Yeah, it's quite a milestone.
It really is. So share a little bit about how it has, what the mission was at the beginning and how you all are still carrying that on.
Yeah, so the mission of Valley Health has really never changed. It's been to provide access to affordable, quality health care to all people, regardless of the patient's ability to pay. And so we have programs that are specifically intended to help people to be able to afford health care. Understanding the history of Valley really requires a bit of a history lesson, if you'll bear with me for just a second. In the 1960s, the poverty rate in the country was quite high. It was at 20%. And so Lyndon B. Johnson and his War on Poverty allowed for a pilot program for what were called neighborhood health centers. And there were 2 in the country. It was a 10-year-long demonstration project that went really well. And so in this mid-70s, it became more of a formal funded program. And it was right at that time that Valley Health started with 3 locations here in this region, right at the sort of dawn of the movement of community health centers.
Right, to kind of tackle some of those challenges.
Absolutely.
Well, it's interesting you mentioned the history because you all have a new documentary out. And I want us to kind of pause and take a little listen right now and share some of it.
I was there when we put the original mission on paper. It's always been about taking care of people, regardless of their abilities to pay, to the highest quality.
We live there in the community. We know what the community needs. We're not just coming from somewhere and saying, okay, this is what you need and this is how we're going to do it. No, we're answering a call, but we're answering a call of what the community is asking for. It goes back to the basic thing about listening. When you go to see your physician, you want to be heard. You go to see your dentist, you want to be heard. You're not talked to or talked down to.
Oh, and I love seeing the old footage and the pictures there.
Yeah.
So, Dr. Weimer, what does it mean to be a federally qualified health center, and how does that really affect the care that you all provide?
Yeah, so you'll hear 2 terms interchangeably. You'll hear Federally Qualified Health Center, FQHC, and then Community Health Center, or CHC, and they really mean the same thing. We have some obligations as a FQHC that are mandated federally, that we have to provide certain things like a sliding fee discount program for patients based on income. And so that's one of a handful of things that we have to do as an FQHC that it really does allow us to provide care where otherwise people might struggle to get care. You also see a lot of integrated care. So we're primary care focused, family medicine and pediatrics, things like that. But we also have behavioral health right in the building, not just located with the primary care, but truly integrated. And you can say the same for things like pharmacy and clinical pharmacy, optometry and other services. So that's really the experience that we hope patients will see, that they'll experience when they come to see us. Not anything all that starkly different than any other care setting, but that integration of care, that comprehensive nature of care in the communities where we serve patients is really what we're all about.
And it sounds like you all have evolved a lot over these 50 years. I mean, we're looking at some of the footage, some of the big changes that you all have brought to these communities. That's amazing.
Yeah, we sure have. I mean, we've started as 3 locations in Barboursville, Wayne, and Milton, Grant Medical Center, and now we have over 60 locations in 15 West Virginia counties, 1 county in Kentucky, and 1 in Ohio. We just surpassed 1,000 employees, I think as of this morning, 1,033 employees, really doing, answering the call when there is a need for access to care in rural and other communities in our service area. If it makes sense for us and it makes sense for our community, when we are asked to step up and serve, we often will.
Yeah. Okay, so looking ahead, how is Valley Health preparing for the next 50 years and beyond?
Yeah, our strategic plan is called 50 Forward. So as we mark our 50th year, looking back and celebrating all the people that helped to make these 50 years possible, all the patients that we've taken care of, we're looking forward as well. And so what that means is financial stewardship in the face of uncertainty in healthcare. It means embracing technologies where it makes sense to, so even things like AI. And it means partnerships with other community organizations, both in the healthcare sector outside of it, and then expanding where it makes sense for us to expand.
Well, and congratulations again on 50 years, and the documentary is amazing. I'm guessing people can go to your social media sites, YouTube, all of that, and they can watch it for themselves.
Absolutely. Our social media and our website have a short version, a 5-minute version, and a longer 30-minute version, and I'd be remiss if I didn't thank Impact Media for helping us with it.
It's great. Well, Dr. Weimer, thanks so much for stopping by and talking about some of the changes over the years, and again, congratulations.
Thank you so much.
Yeah. All right. Hey,